Well, joining us now, the Union Health Minister, Dr. Vardhan. So thank you very much for speaking to us. You know, the report that we've been carrying is that 11 newborn babies, all of them not even 1 month old, died in Srinagar at this hospital because the systems over there, ventilators and things like that, did not have electricity. These babies died. But if you look at the larger picture, is it now your concern that health remains the biggest issue in Jammu and Kashmir, particularly Srinagar? Illness and disease, that's the biggest threat.
Definitely, it has been my concern from the very first day, and that is why on the very first day when these floods had come, even before anyone else might have thought of doing something, we had started dispatching our health professionals there, and we had sent 2 public health specialists team on the very first day. And till now, we have already sent, you see, everything possible, whatever from the health side, whether it is doctors, specialists, psychologists, counselors, medicines, tents, chlorine tablets, whatever is required from our side. And all our senior officers have already gone there. Some senior officers are already stationed there. And in fact, day after tomorrow, Sunday, I am also going there to review the whole thing. Our doctors are already working hard in the various camps also, and we are regularly monitoring everything. But this is most unfortunate if these young children and infants, they have died. We feel so sad and bad about it.
So what about others? For example, patients on dialysis, those who are diabetic, those who need urgent attention, urgent evacuation. It's impossible for the armed forces, for Jawans, to decide who is ill, who is more ill and who is less ill. But isn't it your concern that, for instance, kidney patients would be worst affected, those on dialysis would be worst affected if they are still alive? So the plight of those patients would be of the biggest concern.
You see, definitely somebody who is needing an urgent treatment, he definitely requires immediate attention and immediate help. And I agree with you that it's very difficult for the army to differentiate between a particular person or a particular patient or various varieties of patients. But I think the army has already done a very, very commendable job, and the whole country's machinery has been mobilized. All the departments of the central government have already swung into action, and there is a monitoring of the whole situation at the level of the Prime Minister himself on a day-to-day basis. I think we are putting our heart and soul into it, and as health minister also, when I go there on Sunday, I will review this particular aspect also. I'll visit the various places where we are actually giving all these treatments, and possibly the medical college also, and see how best we can actually handle such situations where if a diabetic is waiting for a treatment and if he doesn't have a medicine, I think we have made elaborate arrangements to see and ensure that the medicines and the required medicines, they reach the right persons at the right time.
Sir, last question. What about the danger of waterborne diseases from here on? Because we've got reports, and these are confirmed reports, of carcasses of animals floating in the waters in Srinagar now. Is that your biggest concern?
Yes, of course. As a doctor also, and as the health minister of the country also, I know that once the water situation becomes normal, or if the waters start receding, certainly we are bound to have these waterborne diseases, and we have already dispatched a lot of material for handling cases of diarrhea, gastroenteritis, and we are prepared to handle diseases like viral hepatitis and others which are likely to happen post all these floods. You see, we are thoroughly prepared and mentally very alert, and actually in touch with everything whatever is happening there, from all possible corners from all possible mechanisms. I am gathering all possible informations and trying to do the best whatever we can. And I am confident that we will be able to handle these waterborne diseases also the way we have been able to handle other things till now.
All right, Dr. Harshvardhan, thank you very much for speaking to us. The Union Health Minister over there expressing what his concerns at this stage were. But just how bad is the situation? How many people have actually lost their lives? In flood situations, it's not often possible to get an exact number of people who have died very soon. It could take days, weeks, sometimes even months. That remains a statistic which would perhaps take a very long time to get. But let's get the very latest ground situation, not just in Srinagar, but in other parts, Rajouri, Poonch, the areas north and west of Jammu. I'm joined by my colleagues Aanchal Vora and Sudhir Ranjan Sen. Aanchal, let me come to you first. Water levels in Srinagar. The army yesterday told us that water levels were coming down a few feet every few hours. Is that the case today? Are more people slowly being able to walk to safety, or are some areas completely cut off even now?
Vishnu, some areas are completely cut off now. Many areas still inundated. Water, yes, is receding, but the Jhelum continues to overflow, which essentially means that the embankment that was breached, it would take army some more time before that can be fixed. In many areas, water stagnating. To that the army tells us that they're going to start pumping water out. But how much water can they really pump out? A lot of it is still there. Right now, Vishnu, I'm surrounded by the unsung heroes of the Indian Armed Forces. These men have been out rescuing people, providing relief day and night. And also with me, Wing Commander Nikhil. It is his unit that first responded to the crisis. Let's speak to him about essentially how the winching operations have been scaled down, sir, because you're providing relief, but in many areas people are pelting stones.
First of all, they've not been scaled down, they've been restricted for the moment, because you really cannot have a helicopter go down in a densely populated area. It's got its own troublesome issues. And second is that now the boats are there in plenty, so as to pull out people who are in immediate need. So wherever the boats have reached is the place where we don't really require to winch up. Wherever they've not been able to reach is the place we are winching up. Even today, we winched up plenty.
Sir, you were earlier telling me a story of one of your boys who flew a sortie and his chopper was being stone pelted, yet he managed to rescue the maximum number of people.
Yes, ma'am. This boy, when his co-pilot did call out that they're being pelted at, immediately stepped up his height, maintained his composure, continued till the time he could winch up maximum, picked up everybody that he could to his max potential for that day, and got everybody back. Yes.
Is it demoralizing for you and your boys that you're providing relief and incidents like these are occurring, and why should they occur at all?
Sad, yes, but if at all, it kind of charges my boys up so as to even more show more resolve and continue, because lives need to be saved for the moment.
Thank you for talking to us. Wing Commander Nikhil Vishnu talking about how the Indian forces are determined that they're going to be on the job and continue whatever the circumstances are.
Okay. Sudhir Ranjan, let me come across to you. You've been traveling in a lot of places which haven't really got that media attention that Srinagar has for obvious reasons. It's a city, large number of people. Because the areas where you've been reporting from are far-flung areas, and the areas within these larger geographical spaces are villages, some of which have been entirely destroyed. Today you brought us a report of as many as 18,000 people walking for almost a week, getting out of these areas. Tell us that story, what really happened?
Well, Vishnu, it's an amazing story of human endurance and sheer grit to survive. There at least 18,000 people have crossed over. Now, for our viewers, the Jammu-Srinagar highway is blocked. There are huge landslides, and it's not open to vehicular traffic. The only way you can reach them is through the air. But within today, it started. The trickle started yesterday, and it's turned into a deluge today. There are 18,000 people who have come here. In fact, we are in one of the camps out here. The army has set up the camps. The locals have come out. The locals have come out in a very big way, providing food, and relief to the people along with the army. What basically is happening, Vishnu, is they are walking across the mountains. Some bit of the mountain track has been flattened by the army to help them. They come down into Jammu. From Jammu, they are picked up. They are brought into these makeshift camps where there are langars set up, one like the one behind me, one like the one that has been set up by the locals behind me. This is where they get food. And after that, what happens is they are put on buses from here back to their, back to towards Udhampur, towards Jammu. If I can ask my camera to pan a little bit, आप लोग थोड़ा सा हटिए, थोड़ा सा जगह दीजिए. That is the number of people still waiting here. The local administration, the Indian army, continuing its work day in and day out. Of course, the locals helping them out. थोड़ा सा जगह दीजिए वहाँ से, हट जाइए. You can see those people. Vishnu, let me give you a quick update as to who these people are. These people are basically laborers who were there in the valley. They are now leaving by the thousands. Most of them say they've had to sell their mobile phones because they had no money, because they have not been paid even from where they were working. And what we see is that tomorrow they're expected to be another 7,000 to 8,000 people at least who are on the other side, on Ramsu side. Between Ramsu and Ramban. Ramban is where I am. There is a huge landslide cutting off this entire Jammu-Srinagar highway. Another 8,000 to 10,000 people expected to come in. The immediate impact, of course, Vishnu, is that once everything settles down and people try picking up the pieces and getting back to their lives, where do people come to work? Because right. People, the people you see behind me there are people who are working in the farms, people who are working as daily laborers. Back to you, Vishnu.
Sudhiranjan, very briefly, we were talking about the floods all across the state. While that may be a reality, landslides because of torrential rainfall which preceded the floods in many of the areas where you've been reporting from, is that also a concern? That landslides have affected a lot of villages where the existence of which people may not even know about, because these are small villages in far-flung areas. Landslides, not just floods. The big threat, big concern?
Yes, Vishnu, that is a very big concern. In fact, in the morning I was speaking to some people in the administration, in the Indian Air Force and the Indian Army. What they say is, as the road linkages are coming up, more and more destruction is coming up, coming to notice. And in fact, yesterday we had gone to one of the villages called Saddal. That Saddal village doesn't exist anymore. It had been taken away it's been eaten up by a landslide. So the fear amongst the administration, the fear that is there, is that perhaps there are many more such places which hasn't yet been discovered or has not yet come to notice. Vishnu.
All right, Sudhiranjan and Anchal, thank you both very much for joining us and bringing us all of those reports.